A patient died unexpectedly. What happens in the physician's mind when this happens? When a patient unexpectedly dies, either for a surgeon or a physician or a healthcare provider or any healthcare professional, what happens in their mind? I'm going to dissect this idea. I'm going to dissect what actually happens in a physician's mind when their patient unexpectedly died. This is a topic that is seldom discussed or thought in medical profession, but today I'm going to take this opportunity to dissect it and see what really happens in the mind of the healthcare professional or a physician or a surgeon taking care of this patient. It hits you, number one, it hits the physician really bad, especially if the patient is well known or the patient and the family is well known to the patient, established a good rapport for some time, and the death is totally unexpected. The passing is completely unexpected. It hits for three reasons. It takes a heavy impact on the mind of the physicians for three reasons. Number one, the goal of a physician's practice, the idea behind practicing medicine is twofold. One is to prolong life, second is to decrease suffering, prolonging the life of a person and to alleviate or diminish the suffering due to an illness or a disease or what have you. When death unexpectedly happens, the physician feels that he has failed in discharging these duties as a physician, and therefore he or she immediately feels a sense of failure of not discharging or not able to accomplish his duties. That is number one. Number two, if you look at the training that a physician undergoes in medical college or medical school and later on further training, what essentially happens is twofold. One is they get trained in the technical side of medicine, which is to say the anatomy, the physiology, biochemistry, the surgery, the pathology, and all this is the technical side of medicine. And then they also get trained without or with their knowing, without their notice, they get trained in putting thinking before feeling. See, usually human mind, when the human mind looks at somebody who is suffering, usually empathy or sympathy kicks in and feels for that patient, feels for that individual who is suffering. We can see that when our family members are going through suffering, we immediately feel for them. We feel bad. We don't think, but we feel. Whereas in medical training takes you from feeling to thinking more, from feeling less to thinking more. If somebody is bleeding, my physician mind immediately asks the question, what is the blood vessel that is bleeding? Is it an artery or is it a vein or is it superficial, deep? How much blood was lost? How can I tie up the lacerated blood vessel? How can I suture it? How can I put a band-aid and stop the bleed? This is thinking. So thinking comes first and feeling comes later. After you have taken care of the acute situation, then you may feel more about it. But first, of course, the feeling is not completely gone away. The feeling is there, but the thinking takes precedence. The thinking is more important in a situation where your services or the physicians or surgeon services are required. So your medical training takes you from feeling less to thinking more. When somebody unexpectedly dies and there is nothing to be treated, it's all gone. The life has passed. The feeling starts coming to the surface. and the thinking part does not have any role there anymore. When the feeling kicks in, that's when you start getting, I don't want to say uncomfortable, but you don't know how to deal with it because you're not trained much in your medical training to express your feeling. So when the thinking goes away, you need to have a way to express your feelings to the family members of the deceased patient. So this is the second thing that happens. First one is a sense of failure, a feeling of a sense of failure because the goal of medical practice is to prolong suffering and to prolong life and alleviate suffering. So that sense of failure. Number two, when there is no place for thinking anymore, the feeling, a way to express your feeling becomes important. And if the physician is not trained to express the feelings in a way that is meaningful to the family members, then it becomes an uncomfortable and an awkward situation. Number three, the physician moves on, but the memory remains. The memory of this event, this unexpected demise, unexpected passing of the patient remains in the memory. And the physician learns from this experience. Either have I done enough to prevent this? Is the medical side of the memory. The second side is the meaning and the purpose behind life. They say every physician is a philosopher because he or she goes through life and death. When you see people dying, when you see death, you can't but appreciate the importance of life and the non-physical dimension of it. So three things happen when a patient unexpectedly dies and the doctor, the physician moves on to the next patient because there is more lives that he has to take care, and the goal kicks in again. The thinking mind, the thinking cap is back on. The goal of medicine to prolong life and alleviate suffering kicks in and he moves on.